Hi, Seth Bilazarian from Pentucket Medical Cardiology on a few recent comments about what's been in the news lately about healthy diet, especially healthy diet for our heart patients. A lot of these new information that comes out can be very confusing to the patient and often is a source of frustration. Patients will say butter or margarine. I don't know which one. The news goes back and forth. Most recently, we've been hearing about how the Heart Association is going to de-emphasize dietary cholesterol as an important thing to avoid. What that really means is eggs. Eggs are a excellent source of protein. They have no fat, they have no carbohydrate, but they are a source of cholesterol. And they're a small source of cholesterol. And what the Heart Association has decided after years of study is that eating cholesterol does not raise the level of cholesterol in our bloodstream. So this is an example of a source of confusion for patients. And it was all well-meaning. Previously, it was concerning that if we ate too much cholesterol, it may raise our serum levels, but it's been found not to be the case. There's also an emerging amount of information that says that if we focus too much on fat or dietary fat, particularly from animal sources like meats or dairy products, that focus alone of reducing that has caused other problems in people's diet and health. What happens to some patients when they dramatically reduce the amount of meat or dairy products and therefore dietary fat, they may increase carbohydrates. So they may eat more cereals, bread, sweets, and what can result is the patients can become overweight. And a rising amount of obesity in our nation and diabetes has led to a rethinking about this. Some physicians take a very simple approach, which has a certain amount of reason to it. And that is eat what you enjoy, but stay lean, understanding that the dietary results of gaining weight or gaining fat, particularly abdominal fat, can really cause significant consequences for diabetes, high blood pressure, cholesterol, and heart disease, of course. So the limited comments I will say is try to obviously stay lean. I think that's very important. We also emphasize the importance of staying active, but don't become frustrated with these new recommendations that are coming out. They're really an evolving science. Talk to your physician and review what's best for you. And I think that at this point, the simplest recommendation we can make is the American Heart Association's recommendations for a Mediterranean-style diet, which is enriched with fresh fruits and vegetables, avoiding processed foods, and having a diet that's rich in fish and grains as well. And the link below to the American Heart Association diet is one that I think will be very valuable to many of our patients in that regard. The final new piece of information I will say, which I think was another piece of information that adds to this area, is the importance of fiber in the diet. And fiber comes from often fresh fruits and vegetables again. And a source of fiber can actually be very helpful. In a paper that just came out this week in the Annals of Internal Medicine, also referenced below, looks at a study done at the University of Massachusetts, right here in Massachusetts, in Worcester, Mass., looked at using a diet that just enriched diet with fiber with no other changes versus following the American Heart Association recommended diet. And the amount of weight loss and other metabolic parameters like blood pressure, cholesterol, and sugar were equal in the two groups, speaking to the importance of fiber. So again, this message shouldn't be taken to say, eat whatever you want, eat bad foods and add fiber. It's a diet enriched in fiber is very valuable and useful. So until next time, thanks for listening and talk with your doctor about excellent dietary strategies. Thanks.